And as I mentioned previously, 20% of the Medicare approved costs are you're responsible for at that point. So what you want to do is look, I'm just trying to make sure can you see me all right? Catherine? Everything okay?
Yeah, we can see it.
Okay, great, because I lost it for a second there. So Part B, your monthly premium, as I said, is determined by your income, and Social Security will tell you what that is. And if you have to pay more than that $144, they'll notify you, and it's all based on the income of the prior year. So when you first retire, you may have to pay more money because the prior year you would have made your regular salary. But then after that, they reevaluate every quarter and give you a new estimate of how much is required at that point. Like I said prior, you can't be turned down for anything when you're enrolling in A and B, no pre-existing conditions, no underwriting. And the coverage, you can get any doctor that participates with Medicare will accept the new patients, and some of the health care is provided. So what I want to do is find out what's not covered. A lot of people say, oh, this is great, everything's covered. What's not covered? So you want to know what your out-of-pocket costs are going to be. Medicare Part A and B, the deductibles, the co-insurance, and the premiums are not covered. Something called excess charges are also not covered. And excess charges are something that doctors and hospitals can do. It's above what is negotiated between Medicare, and then you would be required to pay that additional amount. Something else that's not covered usually with original Medicare A and B is your prescription drugs, and any additional things like hearing, dental, and vision are not covered. So those are where some of the reasons why a Part C has been created or Medicare supplements were created, and that's to deal with the gaps in between. So what is Medicare Part C? You may have heard this before, and Medicare Advantage plans. They operate much like an HMO or a PPO. And what that means is when you decide or you're selecting that kind of coverage, you really need to be aware of networks. If a hospital or doctor you like is in that network, they are offered by private insurance companies. If you are turning 65, you'll know that you've probably gotten, within that year prior to turning 65, you will get so much information from so many different insurance companies about the plans that they offer. It's overwhelming, and you need to find, in my opinion, you need to find a professional to help you figure out and navigate through this little bit of a world, but at least you'll understand and know what the differences are. Sometimes the premiums for Medicare Part C are extremely low. They could be $0 a month premiums, but remember the old adage that people say, you get what you pay for. It may be cheaper right now, but you may have unexpected costs down the road that you weren't anticipating or weren't aware of when you selected a Medicare Part C. And then there's some Part Cs that everybody's fine with and they never use it. So you have to really understand what the differences are so that you make the right decision for your healthcare situation. Some of the other benefits that you'll hear in the Part Cs are vision care, hearing care, nurse support lines, that type of thing. So who's eligible for Part C? Well, anybody that is enrolled in A and B, you must live in the planned service area, and your eligibility does not matter about your health or how much money you make or anything along those lines. You're eligible to join any of these plans at certain times throughout the year. And you must not have end-stage renal disease. A lot of people ask me, what is this end-stage renal disease? Why is it brought up all the time? Well, there's certain plans, certain Medicare plans for people that have that, and they're a specialized plan. So that's why in Medicare, they keep bringing that up for different enrollment eligibilities. All right. Like I mentioned, there are many different types of Part C plans, much like what we have in the under 65 world. You have HMOs, you have PPOs, there's special needs plans. People that might have chronic heart disease might qualify for a special need plan. There's something called an HMO point of service plan that is negotiated with different networks, different hospitals. There's also private fee-for-service plans and medical savings accounts. The most popular ones that I see in my practice are the Part C, HMO, and the PPO, sometimes a special need plan. But if you're interested in any of these private fee-for-service plans or the medical savings account, you really need to understand what is included and what is not. And that's a very specialized area, but feel free to call me at any time if you have any questions about that. Okay, so Medicare Part C, like I said, it operates much like an HMO or a PPO. There's plan premiums, and the terms can change from year to year. As we all know, if we were working and have health insurance through our employer, those things, it's a similar situation. The healthcare, the private companies will come out with either different premiums, different things that are covered. Co-pays may change, so it can change every year based on the carrier. It is a convenience of a one single plan. So if you do go with the Medicare Part C, sometimes they have drug plans, sometimes they don't, but A and B and D are rolled into something called Part C. Sometimes I call it the alphabet soup of Medicare and understanding it, because you could have A, B, and C parts, and then you could have plans A, B, and C, and D, and H, and F, and K, and J. So I know it's a lot of letters getting thrown out there, but we'll try and make it as easy as we can as we go through here. Coverage is often limited to a specific service area. So that means networks. So if there's an emergency, you can always go to a certain doctor or hospital under a Medicare Part C. But it has to be justified through Medicare as an emergency. Like an urgent care visit if you're out of town or if you're traveling or things like that. And you may be required to see the doctors and the hospitals that are in your plan's network. What that means is you really need to be aware if you pick a Medicare Part C, if you have a favorite doctor that is in your city or a hospital that you absolutely want to go to, you really need to make sure that those Medicare Part C plans are covering those particular networks and hospitals. Okay, what is a supplement plan? You may also hear this it's also known as a Medigap policy. So just like the name says, it covers the gap of that 80% that we talked about earlier on the Part A and Part B. If there's a gap there of 20% and nothing, you could really incur many expenses if you don't have something to cover that gap of the 20%, because that doesn't max out or it doesn't cap or anything like that. So what could happen when you have a Medicare supplement, or what does happen, is where the 80% stops with the Medicare plans for Part A and B is where the Medicare supplement plan takes over. So you're taking that additional 20% and it's covered through the Medicare supplement plan. There are many different insurance companies that offer supplement plans, but what is very true is that whatever the plan is, whether it's A, B, C, F, G, K. Now remember, plans are different from parts. Part A, Part B is different from Plan A, Plan B, Plan F, Plan G. The plans are the same regardless of what private insurance company or the carrier has. They're the same plan across the United States. Whether it's in California, it's Kentucky, Pennsylvania, it's all across, they're all the same plans. What's different is how much you pay for the premium and how much that the carrier, and what type of carrier are they? Are they somebody that is very good with their Medicare recipients and they are very good with customer service? Is it somebody that's had trouble in the past? A carrier that may have had trouble? These are the things that you need to know and what a professional in your area could help you with. Earlier, Catherine said, I've been in the financial services market for 25 years. I've also been in the Medicare world and working with supplements for 25 years. I've seen carriers come and go. I've seen companies that you thought are great in the under 65 healthcare environment are not now, and they're not good with the Medicare pieces. So get with somebody who's a professional so that they can give you their advice on what they've seen throughout the years. That would be my one suggestion. So Medigap policies are also standardized, as I mentioned, throughout the US, and each of these plans varies. I can get anybody a copy of what the plans are and what's covered and what's not under the Medicare supplements. But the ones that I like the most are plans G and plan N. And I can go into that for why I like them, but those are the most popular ones. F is no longer available to anybody currently going into Medicare after January 1st of 2020. So that's another thing that the plans change. They can change throughout the years. There was a plan J at one point, now that's gone. So it is different. It can be different as the years go on. Okay, so when can you go to open enrollment? You're guaranteed issue, or it's a guaranteed issue during your open enrollment period. I'm going to show you a little bit of a slide in a little bit that will give you a visual of when can you enroll. You can enroll 3 months prior to your 65th birthday and 3 months after. Those are the time where you are guaranteed to get into one of these plans without any medical underwriting, and no, you can't be denied. You're automatically in there at that point. You can apply later, but you might, like it says, you might be charged due to an existing health problem, or you could be told you're not even allowed to get a plan, a Medicare Supplement plan. It does also go anywhere in the US, and if you pay your premium on time, and you didn't misrepresent anything on your application, then you will be guaranteed to have that Medicare Supplement plan for the rest of your life. Why is this important? To know this during here. Before I get into the Medicare Part D, we're going to stay on this subject. I'll just share with you a story. A lot of times I find people during open enrollment, and it'll make sense in a minute. You can apply for new plans for your Part D, which is drugs, and for Medicare Part C during open enrollment. Open enrollment for every year is October 15th to December 7th. What I find most people who are starting to use their Part C plan want to get into a Medicare supplement during that time. If you're healthy, that's not a problem. If you're unhealthy, which is when you start getting all the fees incurred with a Medicare Part C plan, jumping into a Medicare supplement plan is very difficult when you're not doing well health-wise. So that's why it's important to think, how do you want to deal with your health care down the road? I work with both plans all the time throughout the year. I know the pros and cons of each, but you really need to make that decision for yourself and figure out what is the right path for you as the years go on. Because inevitably, we're all going to use the plan at some point. It may not be right when you turn 65, but it may be when you're 75, 80. And something you need to address it as it relates to your health. So what I think I'm going to do is do another polling question. How about we do the last one, Catherine, if you don't mind. Are you there, Catherine?
Yeah, sorry, I'm getting it.
Oh, that's okay. I just wanted to make sure. And I do have a couple questions here after we get the poll done. Catherine, how do I see the poll? Like, will it just pop up?
I don't think it pops up for the panelists, but everyone else
Okay.
should be seeing it now.
Okay. So then do I know the answer to the polling question?
I can share the results at the end.
Oh, okay. All right, that's good. This is the first seminar that I'm doing with polling questions, so it's very interesting. So I'm going to I'm going to answer these live, some of the questions. I'm going to stop for a little bit. I have a couple questions that are coming up. Is that all right to do, Catherine? Answer the questions live? Okay. Are handouts available? Yes. At the end, if you could, how are we doing that? If I wanted somebody's email, Catherine, do they put it in the chat box?
Yeah, they can put their email in the chat box, but I'll also probably send out the slides with the CPE certificates and evaluations.
Okay, yep, that is no problem. If anybody wants the slides, they absolutely can. And the second question, that $144.30 is for each spouse. That is correct. for Part B, whoever is on Medicare, it's $144.30 for each of you that are going to be in Medicare. Do the supplements plans cover things not covered by Part B? And the answer is no. If it's not covered by Medicare, it will not be covered by a supplement plan. What does happen with a Medicare Advantage plan is that they have some things that are covered. So they might say in an Advantage plan, oh, we cover dental, we cover vision, we cover hearing. I have to say that what is covered is not very robust. You might have $100 towards eyeglasses for the year. I'm finding that you probably could either do better with a separate plan or just paying on your own than going to, I would not go with a Advantage plan just for those ancillary things like your vision, your hearing, and your dental. There are some plans out there, separate plans that you can buy separately as an individual to cover some of those things. And they're becoming, the marketplace is becoming more aggressive with addressing those issues because these are the things that you need as you get older. You need a hearing aid, you need to get glasses. Most of the time you need dental. Those are the things. So I'm seeing as the years have gone on, more aggressive options for people. I hope that answers that. Okay, difficult joining a Part C later. Is it true if you have a working spouse with group insurance? No, it's not difficult to join a Part C later. What's difficult is to join a Medicare Supplement later. If you have, and that's a good question, Catherine, if you have your husband or your wife is working and you currently have a group health insurance plan and you're on that and it's considered credible coverage, the HR department at any of the companies would know if it's considered credible coverage. What that means is that you've taken the group health insurance. There's no penalty for doing that after you turn age 65. So a lot of people are working into their late 60s and 70s. You still have that guaranteed issue whenever you are done with your health insurance, or your husband retires, you retire, and now all of a sudden you're not going to have that group insurance. Now it's time to look at Medicare. As long as you had credible coverage since age 65 and there was no gap or lapse in that coverage, you have an open enrollment period, and a guaranteed issue period where you can go whichever plan you want without that. What I tell people for that is, look at it and see which one is better. You're always going to, when you're age 65, even if you're with a group health insurance plan, you're going to have Medicare Part A automatically. You don't pay a premium for that. What the group coverage will do is use Medicare Part A first, and then we'll use the group coverage as the secondary insurance on that. So I hope that answers a little bit of questions on those questions. All right. Medicare Part D. Medicare prescription drug coverage. This is a piece you would definitely need a Part D if you go down the path of choosing a Medicare supplement, because there is no prescription drug coverage. Some Part C Medicare Advantage plans, those are one and the same terms. Some of those plans cover drugs and prescriptions. It just depends. It depends on the plan, and you have to look every year to figure out if your drugs are covered and if they're still covered under the formulary. A prescription drug, its plans are run by all private companies. There are things like CVS, Aetna, Cigna, Humana, Walmart, like they all have their own Medicare Part D plans. You really should every year, my suggestion and what I do with my clients is that we review your drug plan, your drugs that you're taking every year, even if they haven't changed. And why do we do that? Because the formularies could change with each of these carriers. A drug that might be covered this year at X dollars, say $10, might be $30 next year. So the formularies change every year. During open enrollment is the time to do that, even if you have a Medicare supplement. You want to look at your Part D coverage and see where you're at. And what plan might be good in 2020 may not be the same plan that you might need in 2022 Now, I had somebody who, I'll just tell you a little story of one of my clients. I have a client who has MS. And every year we look at her plan because she could be on the same exact drugs, and because they're very high and expensive drugs, just by moving from one carrier to another, one year we saved her $3,200. Now that is a lot of money just for being on the same medications and moving to a different carrier. So that's why it might help you. I'm not saying 3,200 for everybody, but it's something that would be in your best interest is if you checked on that every year. You always have to pay your Part B premium in order to get any Part Ds. So that's something that people often ask me as well. What should you know about, I mentioned some of these earlier, but what should you know about prescription plans? They vary from plan to plan. What might be metformin on one carrier might be one price is different on another carrier. That's to some example. But you really want to know, and I'm going to walk you through what the donut hole and the catastrophic coverage is. I'm going to show you a little graph that will explain that. This catastrophic phase, there's phases of drug plans. And remember, a lot of us under age 65, when we have group health insurance, we are used to the drug plan being rolled in with our regular medical plan, and it's just the price is the price. This is different when you're on Medicare. Medicare Part D is its own separate plan with its own separate premium with its own separate carrier. So you'd have a whole other carrier that you want to deal with. So Medicare, the Part D plans have different phases, and that's very different. Something to learn when we're looking at Medicare. Each plan has a different list of what's covered and what isn't. You have to have a certain number of types of drugs in the plan, but the actual particular drug does not have to be in any plan. You want to make sure whatever drug you're taking is covered under that plan before you enroll. What I always tell people, a lot of people will call and get their Medicare supplement, I'll just make up something, from a Blue Cross Blue Shield provider. And then they say, well, don't you need a drug plan? And everybody's like, well, yeah, I need a drug plan. And then you'll sign up for the Blue Cross Blue Shield because that's what we're used to doing. But you really want to investigate that because every carrier is different with what they cover, what they don't, how much it will cost. So that's something to be aware of as you're going through and figuring out your Part D plan. And something that is very different with Medicare Part D is the last point that's on the slide. Penalties may apply if you enroll late. Remember again, it doesn't apply if you have credible group coverage. Credible group coverage with your group health insurance, you would not get penalties. The only time you would get penalties is if you were supposed to enroll, you had no other option, and you just chose that you didn't want a plan, a prescription plan. What kind of costs are involved with a prescription plan? Well, you have a premium that you'll pay every month. You have a deductible. Right now, most plans are about $400 deductible every year. But that doesn't include generic drugs. Some of them, the generic drugs don't count towards the deductible. Each plan is kind of constructed differently for each carrier. Unlike our Medicare Supplement plan that we talked about earlier, where it didn't matter which carrier you had, it was the same plan irregardless. This is different when you're looking at Medicare Part D. Those plans can be different. There's a co-payment. When you go to the pharmacy, you go up and you pay your co-payment. And some things have co-insurance, which is different than your co-payment. That means a portion of it you're going to always be responsible for. Okay. All right. So any questions about 9D on the Part D? All right. Brenda had a question. I'm going to answer a question as I see it. To confirm, if you are enrolled in a Part C at age 67 and want to get a supplement, you can. You just have to be underwritten. That's absolutely true. And each carrier has a different criteria for underwriting. If you have the Part C and you think you're in good health, it's worth a try. That's what I would tell people. If you've now said, hey, I went in a Part C at 65, I didn't know that I wanted a supplement. Now I know I want a supplement. Try and go through the underwriting process. The only thing they could say is no. And if you do get a no with one carrier, it doesn't mean you're going to get a no with every carrier. Some carriers are more lenient than others. Some accept diabetics and some don't. So those are kind of, I would try it. It's better to try and then be told no than to don't try at all, and it could help you in the long run. All right, so we'll continue with the Part D. So formularies, this is something that is that you're going to want to know when you're looking at your Part D. If you see at the bottom, Tier 1, that is your least expensive drug. You'll get a formulary, or you will get a report from when you're looking for things to say, oh yeah, my atorvastatin is a Tier 1 drug. That means it'll be in the least expensive class. All the formularies follow this 5-tier system. So if you hear that you're Tier 5 for one of your drugs, you'll know that that is a very expensive drug. And what is a Tier 5 or a Tier 1 in one plan could be Tier 4 in another plan. So you just need to look at that each time and see where it would fall. And you may even want to go back to your doctor and say, hey, do you have anything that's less expensive that could treat the same thing, the same type of thing? But that's between you and your doctor to know what would be in your best interest for them. So this is the new part that I was explaining to everyone earlier. Your Medicare prescription drug coverage. You have an initial coverage, you have a donut hole, and then you have the catastrophic. The donut hole is also called the coverage gap. That's here. It's going to go away in 2000. Some of the brand name medications will go away. They went away in 2019, and they're replaced in generic now for 2020. So this doesn't mean that when you're in the catastrophic phase that you would get anything for free. It just means that your percentages are less in each of the phases. So when you look at the different phases for drug coverage, what that'll mean is when you are in that initial phase, you'll pay a percentage of the plan's cost for a covered drug. Once you and the plan spend that amount in the initial coverage phase, combined on the drugs, and that includes your deductible. Then you move over to the coverage gap. The coverage gap is the phase that you and your plan spend that amount of money. For 2020, it's $4,020 for the initial fees. And your plan doesn't pay for your drug. You pay no more than 25% in the coverage phase for the cost of the brand name and generic drugs in that phase. When you get to the catastrophic phase, you pay no more than 5% of the cost of the covered drugs. So there's all these different phases, and throughout the year, when you go to your pharmacy and get your drugs filled, it'll tell you on your prescription plan or the receipt that you get back which phase that you're in, or it should. Most of the pharmacies are doing that now. I get a lot of calls from clients during the last quarter of the year, because that's when you're most likely going to hit the coverage gap or the donut hole. Also, it depends on how expensive your drugs are. But a lot of people say to me, hey, I only paid like $10 for my statin, and now I'm paying $25. Why is that? Why would it change in the middle of the year? And 9 times out of 10, it's because you've moved from the initial coverage phase into the donut hole. And some people hit the catastrophic phase, which is the least expensive phase of all of the phases. Are there any questions about that? Because that is very different. Okay, does Medicare Part B cover second opinions? And if so, are they limited to certain identified situations? Medicare Part B may cover second opinions, but it's really based on the Medicare rules and for a particular situation and for a certain, whatever the treatment is that you're looking at. But they do cover second opinions, or they should in most cases. But Medicare has very different guidelines on what they're going to cover and what they're not going to cover for things. I just had a client who needed to get a second opinion or a second study for some oxygen that they needed. So if Medicare doesn't think that you've met the threshold of why a doctor would be prescribing that particular medication, they will deny the claim. And that is not anything with a particular carrier. That is a Medicare rule. So you have to understand that and ask your doctor those types of questions too. They should know if Medicare would cover this or not if they work with Medicare patients. And one more question has come in. No, is the $5,100 coverage cap just what the patient pays? No, it's not. It's a combination of what the drug costs, what the carrier pays, as well as what the individual pays. So it's the combination of that amount for the coverage cap. Good question. All right, let's move on to what I call this right now is the decision tree. This is coverage options. Like if I were going to enroll in Medicare, what would I want to know? So you want to enroll in original Medicare when you become eligible. Part A, like we said, a lot of times you'll get that red, white, and blue card automatically in the mail when you turn 65. Sometimes you'll always need to tell them that you want to enroll in Part B when you're ready to enroll in a Medicare plan. Because that's the one where remember you're paying the premium. You're always going to pay a premium for your Part B, $144 roughly for most of us. So, okay, you have original Medicare. You have to have A and B. That's step one. Step two is if you want to have something, why would you even go and get something? Remember, we had that 80% that they're covering for Part A and Part B. That's a government-provided health insurance. There's that 20% that you're trying to figure out, what do I do with that? Option one is you keep original Medicare and you add a supplement and a Part D drug plan. That's one path to go down. The second path to go down is decide, do I want a Medicare Advantage plan? And if you want a Medicare Advantage plan, most of them cover the prescriptions. They have lower premiums in most cases, but I'm finding some of the Medicare Part C's are actually about the same as a supplement. In some cases, if you want that richer plan. And you just need to decide if you want to go from Part C or the supplement route. I'll tell you one of the big differences is that when you have a Medicare Part A and Part B, and then you get a supplement, whatever Medicare doesn't cover with the A and the B, the supplement will cover. And that's it, and you're paying your premium. Say you're paying $200 a month for 12 months. That's $2,400 for a year for an individual. For the supplement plan, plus you need to add your Part D plan. Just remember that $2,400 number in your mind. When you look at option two for the Medicare Part C, a lot of plans have an amount that you can be charged up to $6,700 per year. So what does that mean? That means you could have a plan that has that $0 premium, but once you get sick and start needing care, you're on the hook for $6,700 a year. So imagine if it's you and your husband or your wife or a spouse, and you both are sick. The chances are probably rare that you're both sick at the same time, but I've run across it more times than I would care to imagine. And you're both responsible for up to $13,000 a year in medical costs. That's the potential that could happen with a Medicare Advantage Part C plan. When you have the supplement, you're just going to pay that premium. As long as you pay the premium, then that covers that part that's missing in between the two. Now, something to keep in mind with a supplement, a lot of carriers will initially get you in or have you enrolled at age 65, and they have the lowest prices out there, and oh my gosh, I get a supplement and it's $100 a month. And then as the years go on, as you get older, that carrier is known, and there's some out there that are very, they're known for this. They will increase dramatically as the years go on for the supplement premium. And some are consistently just a little bump every year. Those are the things the ups and downs and the pros and cons of each of the Part A and the supplement and the Part C plans. So I hope that's clear. If anybody has any questions on that, please put it in the chat box and I'll answer that. So like we said, the Part A and Part B, how do you enroll in that? You're enrolling on your 65th birthday, 3 months before, enrolled. It's not going to be effective until you're 65, but you can enroll 3 months prior and 3 months after your 65th birthday. Now, keep in mind, this is when you don't have any other health insurance. If you're still working, you still have group coverage, that's fine. It can also be under 65 if you have been on disability and you've been on disability for 24 months consecutively. Then you'll automatically be enrolled. We have a couple questions coming up, so I'm going to take a minute to answer that. Is the coverage gap going to decrease in the future? Yes, there are plans for that coverage gap to be decreased as the years go on. Now, it can also depend on which political parties in at which time on if it goes through or not, but that is the talk, and that is something that is out there and encouraged as you go through. As they go through, that's the talk, and that's been what's been promised. I hope that answers the question. Okay, the next one. My husband is 60 years old and disabled. He has been on Medicare for a couple of years. We have a supplement and a Part D plan. Can we change the supplement plan and the Part D during the open enrollment in the last quarter of 2020? It's twofold. You can't change the supplement plan. You cannot change the supplement plan, but you can change the Part D plan. When your husband, if your husband's 60, when he becomes 65, a lot of people don't know this, but to think about this, when he becomes 65, you'll have another open enrollment period that you can look at a supplement. So just be aware of that and look at that when he turns 65 if you're not happy with the supplement plan that you have currently. Now the Part D plan, D as in dog, you can change that anytime in that last quarter of the year, but it'll be effective for 2021. Oh wait, we have been led to believe that he cannot change his supplement until he turns 65. That is that is accurate, that is correct. Whoever gave you that information, that is a correct answer. Okay. All right, one more question. What happens if you're self-employed and on private insurance, just paying direct? Does this still count as credible coverage if you want to stay? The answer would be yes. It counts as credible coverage. A lot of people do jump off of their plans and they go to Medicare because it's oftentimes less expensive, but you don't have to. All right. Okay. Okay, another question. My husband is on disability and on a Medicare Advantage plan. When he turns 65, he can change to a supplement with Part D. Is it triggered by his 65 age or the enrollment year when he turns 65? That is by his age 65, not the year. So 3 months prior to his birthday, 65, and 3 months after, he has that ability to go into a supplement plan. Once you pick a supplement plan, can you change during open enrollment in the future? Good question. And the answer is no. The only way you can change a supplement plan is by going through underwriting once you've picked it during your open enrollment period. So we'll stick on that topic for a second. So say somebody picks plan N for a supplement and they say, oh, you know what, I really wish I had picked plan G. If you're in good health, you can go through the underwriting process and see if you can get in plan G. But that's why it's so important when you make these decisions to know what you're getting into. Because if you do not pick the right plan, or say you're down that path, it's very hard to get into a supplement plan after you've chosen one or a Medicare Advantage plan, unless you're in good health. Not that you can't, not that you shouldn't or you won't, but it's just a little more difficult to get into those plans. But if you're in decent health and you want to change the supplement plan, I would try and do that if you're not happy within that road that you're down. Okay, let's continue with it, and then I will be sure to answer the questions at the end as well. And we went through this. When can you enroll in Part C and Part D? 3 months before, 3 months after. And you can always enroll, and remember, Part C and Part D, you can always change those plans between October 15th and December 7th. That's the open enrollment period. Every year, it's always the same. And it'll be effective the following year. So January 1st of the following year. And this answers that question, what if I work past age 65? You can, you definitely want to talk to your benefit administrator, your HR departments, and keep those records of your health insurance coverage. They'll send you with your W-2 or your 1099, they'll send you something that says that you have had incredible health coverage. And then this, if you're retiring after age 65, we talked about this a little bit, you're eligible for a special enrollment period. You can enroll in that plan 63 days, it's very odd, not 60, but 63 days after your employer-sponsored coverage ends. And you want to avoid that lapse in coverage and no penalties or anything along those lines. What do you do next if you're due to Medicare? Well, original Medicare Part A and Part B, you're going to want to enroll through Medicare.gov for Part B and tell them whenever you're ready that I want to start enrolling and when you want the effective Part B to start coming out. A lot of people have their Part B premium come out of their Social Security. If you're not collecting Social Security for Part B yet and you want to pay your Part B, you have to do that every month on your own, like through a bank deduction. Decide if you want prescription drug coverage. Even if you're not taking any medications, you need to sign up for a Part D prescription drug plan, even if you take not one medication, because you will have had that drug coverage. And you can get premiums that are as low as $14, $12 a month. Then that will save you a lot of money in the long term. As it relates to penalties and things like that. So that is a question I get a lot of time. What you definitely want to enroll in some sort of drug plan. Decide if you want that Medicare Supplement, Medicare Gap plan, same thing, those terms are interchangeable. And decide if you want the Medicare Advantage plan. That will, you will no longer have original Medicare, it'll take your A and B and then you'll have Part C. So A and B equals C in that situation. What do you want to do if you're a current Medicare Advantage recipient during open enrollment? Think about these kind of questions. Has your health changed? Has your financial situation changed? Have you moved? You could, if you move, you qualify for a special enrollment period. If you move out of your network, you can look at another plan within that Medicare Advantage world. If you're going to be away from home for a significant period of time in the next year, are you staying with are you staying with your children somewhere? Are you going to go to Florida for 6 months? Think of those kind of things during open enrollment. Are all the doctors that you want in hospitals in your network, do they cover the prescriptions? Maybe you can get something on a Medicare Advantage plan with a gym membership, dental care, hearing aids, that type of thing. October 15th through December 7th is for Medicare Advantage and Part D. If you have a supplement or you are enrolling in a supplement, the only thing you need to worry about during open enrollment is see if your Part D, your drug plan is, you're in the right plan. And that's what we just went through. We just talked about that for the Part D recipients. We've talked about that a lot in the earlier slides. So here's a couple additional resources. Medicare.gov, Medicare Made Clear. These are resources that I have found helpful throughout the years. Again, think of me as a resource as well. I'll make sure that everybody has my email, and I'll work with Catherine to make sure we get that out there. Or I could probably put it in the chat box as well. But I am going to answer these questions that we have left. Well, I think I have 2 more questions. Okay, so once you've picked a supplement plan, that is your choice until you die, unless you go through underwriting. You can't change the plan during enrollment. That is correct. You can't change a supplement plan at all once you're in it, like automatically during an open enrollment period. The supplement plan, once you pick that, that's the one. As long as you're paying premiums, that'll be the one that you have until you die. The Advantage plans, the Part Cs, they can be changed every year. And the Part Ds, which is the prescription plans. That is correct. Okay. once you pick a supplement plan, can you change during open enrollment in the future? No, no. A supplement plan is only that one time during either a special enrollment period or an open enrollment period. So that is what, for a supplement plan, you pick that, or unless you go through underwriting. It's not just an automatic during an open enrollment period. Okay, and then the last question I have is, I'm 62 and I've been on disability for 21 years with a state insurance. My spouse died and my income increased. This took the medical coverage away, although they pay my $144. I need a supplement plan. Can I apply for this in October? No. Somebody that's on disability, if that person, whoever that person is, I can't see who the is, wants to talk to me, feel free to give me a call about that, because that's a very particular situation and every state is different. I can kind of give you my experiences on what I've dealt with in states that are around here with somebody that's on disability at that point. Now I'm totally open for any additional questions anyone might have. Okay, I think I answered them all. And why don't we put out, how many polling questions, Catherine, did we
We
need
have
to
2 more
have?
left.
I mean, how many did everybody need to have in order to get their CE credits?
We have 3.
Okay, well, I guess you could put the 2 out.
Okay, I'll go ahead and launch it.
And then should I put my email and phone number in the chat box somewhere?
Yes, you can do that if you think, if everyone wants to see it. I can also add it in the email when I send everyone the certificates.
Yeah, that would be good. Because for some reason, I don't know. I see the questions, but I don't see a place where I would be able. I can certainly answer any other questions privately or.
I think some have come up in the chat box if you want to briefly go
Oh,
through.
chat box. Let's see. Okay, so I stopped. Oh, wow. Here we go. That was on my other one. Okay. Can't see the screen. Okay, we're down there doing well. Okay. Was that Plan G and Plan N she said she liked best? Yes, those are the 2 plans that I like for my clients, G and N. They have a little bit of different, some things, the Plan N has some co-pays. It's a little less expensive on a premium, but if you went with either one of those plans, those are, I feel, are very good options for there. Okay, Hannah, okay, polling question. Okay, I'm just looking through. Okay, I have one thing here. Okay, good. Everybody found some sort of silver lining in the COVID situation. Glad to hear it. I have too. I am currently 65 with a federal PPO plan, and I had a surviving spouse. And I've had a surviving. This group health insurance benefit continues through my lifetime as long as I continue to pay the premium. Do I really need to enroll in Medicare too? I don't know for sure, Teresa, but if you're in a federal PPO plan, they most likely have you already enrolled in Medicare as the Part A, and then they're taking care of the Part B as well as it could be operating like a Medicare Advantage plan. Federal plans, if you're in it, just keep paying that premium. They're usually very good. But if you want to ask me that offline and I can look at the card that you have and help you with that, that's absolutely fine. Okay, my husband turned 65 in September and still employed and on his company's insurance. I know he will sign up for Part A, but does he have to sign up for Part B? The answer is no, he does not have to sign up for Part B. We plan for him to be either his company's insurance or my company's insurance for at least 2 more years. Yep, you're fine. Just stay with Part A And when you're ready, when either of you decide that you're going to retire and you don't have that group health insurance anymore, that's when you want to look at looking at Part B. You have to get Part B first before you can enroll in any of the Medicare plans. So a couple months before, tell them when you want to be in your Part B plan and start taking out that premium. Okay, I think we answered that one. Does Kristen know about Medicare recovery and the IRS? Medicare has no recourse to collect from the deceased. So that doesn't. I am not familiar with the Medicare recovery piece and the IRS enough to talk about that, Cynthia. So I can look for information and talk to some attorneys that specialize in Medicare and Medicaid and get that answer for you. Oh, good. I'm glad you found it informative. Okay, that is good. What credentials should you be looking for if you decide to work with a professional to navigate these decisions? Okay. I guess I should explain my credentials so that you can understand what to look for in your area. So I'm licensed in over 20 states. That's the first thing. You have to be a licensed agent in life and health. So you have to be a licensed agent. The second thing I would recommend, a lot of my peers and colleagues are just pushing Medicare supplements because you don't have to have any particular certification for a supplement. The reason why I get certified every year for Medicare Advantage plans, because they are truly governed by Medicare and Medicaid, Centers for Medicare and Medicaid, is that you have to go through a credentialing every year to be able to speak to those plans and to be able to offer those plans to your client. I didn't feel that it was, I have an opinion on where I think you should go when you turn 65 based on my experiences, but how can you truly represent all the plans if you don't understand all of the plans? And I have a lot of people coming to me who are on Medicare Advantage plans, and they may not be able to get into a supplement plan. So you need to be knowledgeable about Medicare Advantage. Both, even if somebody's deciding, hey, I'm definitely going to go with a supplement plan, but I do feel that you need to have both in order to speak on this informatively and be able to go through each side of the road, so to speak, and to help people, help your clients one way or the other. So the first thing is a licensed agent in that state for health and life. And then the other thing I would, if it were me, look for somebody that not only offers a supplement plan, but can speak to the Medicare Advantage plans. Because in some situations, that's the only option that people have. And you need to be able to talk that intelligently. And with the right credentials to be able to speak behind that. The other piece that I was going to say about that is I'm an independent broker, and I chose this for a reason. And I feel if you're not working with me and you're looking at somebody else, an independent broker is important as well, because I don't have an alliance to a particular carrier. I'm not always going to recommend Aetna. I'm not always going to recommend ARP. I'm not always going to recommend Humana. It depends on what is the best situation for that client. So I would be wary of somebody that is only representing one particular carrier, because that means that they really don't look at the other carriers to see who's competitive enough and can help the clients in the best way. Another thing to know for all of you that are still on the line is no matter which person you go to, everybody is compensated the same. We're compensated based on the government and what the government says that you can make for working with somebody on a Medicare supplement or Medicare Advantage plan. And it's the same across all carriers, across all individuals. I get paid the same, as somebody out in California and Michigan and Florida. We all get paid the same. And you don't pay anything as the recipient. We get paid by the carrier, and the carrier has to pay the same regardless of which carrier it is. So it takes that allegiance and that alliance towards one particular carrier out of the mix, which I enjoy, because you're just going to offer, or you should be offering, the best to your client, regardless of who's paying you what. All right, Catherine, did I get all the questions?
I think there may have been 2 more added to the Q&A.
Oh, the Q&A. Okay. Do we still have time? Is that okay?
Yeah, go ahead.
Any questions? Okay. Plan. Okay, answered that. That was in the chat box. What can I decide? Okay, that's good. And if you're going to present at our national conference in October, please let attendees know that. Oh, thanks, Stephanie. Yes, I will be presenting in October. I have been asked to join in that, and I'm look forward to it. I always enjoy speaking to the ladies at AFWA. And please, when you get my email, if there's a topic in particular that you would like to hear about, if you think it's Medicare again, if you think it's finances, anything that you like that you think would be good, please let me know. I'm open to suggestions and putting together something for the group. Well, I've really enjoyed it. I appreciate everybody's time today, and I hope that you found it informative.
Yep. Thank you for joining us today. And Kristen, of course, thank you as well. Like we said, she will be speaking our Women Who Count conference in October. So if you'd like to hear her speak again, be sure to register. That's up online on our website. And if you have any other questions, let us know. We'll be sending out the certificates and evaluations as soon as possible.
Thank you. I really appreciate it.
Thank you.
Bye, everyone. Have a good day.
Have a great day.